Hey there, I am Susan Ellenberg, and welcome to this edition of And Just One More Thing. Many of my podcasts have been about mental health and how the county is addressing the public health crises in mental illness and substance use disorders. And today we're going to zero in on one particular program called the Trust Program. Stay tuned and I'll tell you a little bit more about who my guest is going to be, who will teach us all more about trust. Welcome back. My guest today is Elyse Malcolm, who is a program manager with Pacific Clinics. Hi, I am back with Elyse Malcolm, who is a program manager with Pacific Clinics, and we are here to talk about trust. But to quickly set the stage, before we do that, I'll back up to the bigger picture, which begins back in July of 2023. There was a national 10-digit hotline phone number for suicide and mental health crises that was reincarnated as 988, certainly an easier to remember 3-digit code than 10 digits. But what is also striking is that in many counties, including our own, 988 provides not only a hotline for de-escalation of a crisis or connection to services, which it does, but our operators also have the option of dispatching one of 4 levels of mobile crisis service in the moment. There are 4 levels of crisis service. The one that is most frequently called upon is TRUST, and that stands for Trusted Response Urgent Support Team.
Awesome.
Love that when I get it right, which consists of 2 paraprofessionals, a counselor, a clinical counselor, and someone with first aid experience. So, and it's literally physically a van, and there are several of them that are dispatched to go try to meet the needs of a person who is experiencing a mental health or substance use disorder crisis. Right. How's that?
Yep, perfect.
Okay, good.
Spot on.
I feel like I passed the first test there of basic understanding, but Elyse, tell me more about how trust works, what it looks like, why you think it's really the most utilized and the most sought after service in our panoply of crisis offerings.
Of course. And first, I'd like to thank you for giving me this opportunity to be here and share more about trust. Trust was born out of a call to action from our community for more person-centered alternative to law enforcement behavioral health support. And I really feel that we are the highest utilized program because we are community-based.
When you say we Pacific Clinics?
Trust as a whole.
Trust as a whole.
The Trust program, the contract is held by Santa Clara County, and this contract is implemented by 2 of the largest and well-known nonprofits here in Santa Clara County. We have Momentum for Health that runs the North County Trust team, and then we have Pacific Clinics that runs the San Jose and South County teams. And we work very closely with our community, and we build those trusted relationships and rapport that allow us to really identify areas of need within the community and then meet face to face, whether it's at someone's home or at Target or wherever the individual is. We can meet them to provide that support and spend as much time as we need to make sure that we can keep them safe in their community and try to provide resources and provide coaching that will allow the individual and their support system to feel comfortable with the party staying in their home, or maybe getting to another safe space, another community resource where they can receive additional support that will help them to hopefully avoid having to go to the hospital or engage with law enforcement. Or if those things do need to happen, the Trust team can act as an advocate for the individual and remain with them through that interaction and provide more information to the other supporting parties.
There are 2 really interesting pieces in that explanation that I want to pull out. One is that you emphasized that that the people that are working for trust are from the community, they're
Mhm.
paraprofessionals. Is this a peer model, and why is that particularly effective?
So we do partially implement the peer model into the trust team. So the trust team is made up of a crisis intervention specialist. That's
Mhm.
somebody that's trained in de-escalation,
Okay.
safety planning, and a lot of resourcing within our community so that they can help the individual during the height of the crisis
Hmm.
and
Hmm.
really implement tools and coaching to help de-escalate the situation.
Okay.
We also have first aid responders through Pacific Clinics. Our first aid responders hold an EMT license,
Okay.
so they can do a low level medical assessment, and we can determine whether a higher level of medical need is needed to be dispatched, or we can address superficial wounds. So that's a really great aspect of the program. We also have peer support specialists. These are individuals with
Uh,
lived experience, whether personal or within their family, and
hmm.
that really allows us to tailor our support based on the experience of someone who's been there.
Is this a third person
This is a
on the
third
team?
person that can come out with the team. So at
Got it.
any given
Okay.
time, the trust team is 2 to 3 people that will come out and provide support.
Thank you. And the other piece is that law enforcement is not an integral part of trust.
Yes.
And why is that important? And why do you think that appeals to so many people? Some of our higher crisis response levels do include law
hmm
enforcement.
I think that, I mean, it goes without saying that there has been difficulty with dispatching law enforcement to behavioral health crises, and a lot of community members share concern that that level is not needed
Hmm.
when somebody's experiencing anxiety or maybe a panic attack. So I think that having a community-based team where it's somebody that is not um, there to take you anywhere, take you away from your home, is more comforting
Hmm.
to the community and allows them to feel like they're speaking to maybe their neighbor, maybe, their cousin, somebody that they recognize. And we don't show up in with badges or in a uniform. We
Right.
do have trust jackets. And I think that allowing us to get that ball rolling
Hmm.
kind of sets the comfort level for an individual. And if the call does need to go to a higher level, they have a certain level of comfort already and trust in us that we will support them through that process.
And you won't leave before the
Correct.
next
We
group
will not
comes.
leave.
I have heard from law enforcement officers as well that
hmm
they don't want
Right.
to respond to crisis calls. They understand that they are not fully trained. They
hmm
understand the risks, either to themselves or to the person that they're
hmm
responding to. So how can we increase the use in general of 988, specifically of trust? I know that if you call 911,
hmm
um, an ambulance or paramedics has to arrive in every case within a certain amount of time.
Right.
Is that true of trust? And are we at the capacity where we can respond to every call? And in what time frame?
So the trust team attempts to arrive within 30 minutes
Mhm.
of every call. Now, right now, we are currently at the capacity that we are able to do that most of the time. Now, Santa Clara County is a big county, and based
Right.
on traffic and what is going on, we could at some point take a little longer. The good thing about trust and the system that we have built in is that our call center that we operate out of Campbell through Pacific Clinics stays on the phone. So if you call in and you need support for somebody and we say, hey, it's going to take about 45 minutes for the team to get there, but we can stay on the phone with you and we can talk you through what's going on
Mm-hmm.
and continue to provide support until our team arrives. So there is that level of coverage
Got it.
until we are able to dispatch.
And certainly they could decide, the trust responder on the phone could decide this is a crisis that really can't wait for
hmm
40 minutes and we do need 911.
So when that happens, we do
Mm-hmm.
partner with our other crisis teams in the county, such as MCRT. And what we will do is reach out.
MCRT is Mobile Crisis Response Team.
Correct.
And who is on that team?
So that is the county clinician-based team. So they typically address higher level calls that might need a 5150 or somebody that might need hospitalization.
A 5150 is an involuntary 72-hour psychiatric hold.
Correct. So those type of calls typically are diverted to the MCRT team, but
Mhm.
that's not to say that they can't support with calls that don't necessarily need that.
Mhm.
So when we find ourselves in a situation where all of the teams are out, which I will say is not often, most of the time there is a trust team available 24 hours a
Oh,
day to
okay.
respond within 30 minutes. But when we have those cases where we identify a need, we
Mhm.
will collaborate with our other teams here in the
Ah.
county to get a response as soon as possible.
There are a total of how many trust vans in
So
between Pacific Clinics and Momentum?
So Momentum operates a van in North County. We have 2 vans here in San Jose. We have a West Valley identified van and then our South County van. So
So
5.
5 vans.
Yes.
And do you happen to know what the capacity is of MCRT? How many
You
vans they have?
So MCRT operates, and I say this loosely, but they
Sure.
operate in their own vehicles. So the clinicians will go out and respond to cases in their own vehicles. Um,
Okay.
and so I'm not sure how many of them they
Okay.
have, but that's how they respond.
Fantastic. And what we have to wrap up. The
Of
time always
course.
goes so fast here. Um, because at least for me, I find the conversations to be fascinating and I learn so much. Obviously, more money would be delightful to increase the number of trust vans, although it does sound like we're meeting current capacity. Um, what message would you want to share to encourage more people to use 988 over 911 and then specifically to think about trust once they're in the 988 system?
So what I would say is, as somebody who has utilized services prior to becoming involved in them, and activating for my community members, it can be confusing.
Mm.
And when you're calling, you don't know who you're getting or who you should call for what you're looking at in the moment. And I always tell people, trust is a great place to start.
Mm.
If you're not sure who should be coming out or helping this individual, if you're out in the community and you see somebody struggling, they're not committing a crime, they're not hurting anybody, but they definitely need help.
Mm-hmm.
And you would like to be that neighbor, be that community member that offers that help. Trust is a wonderful place to start, because we can go out and assess and determine what is going on and either provide that support, or we can then activate the next team or collaborate with another supportive service to get that community member the help they deserve.
Elyse, thank you so much. Thank you for talking to me. Thank you for teaching me and the folks watching this. I think something that I will take from this is to really elevate when I or my team visit with our neighborhood associations and business associations to make sure they have the trust phone number, that they understand how this works, and that they are in a position to be those neighbors as well. I really
Thank
appreciate the
you.
work that
Thank you
you
for
do,
having
and
me.
am just very grateful for Pacific Clinics.
Thank
Thank
you.
you. I'll be right back. And just one more thing today. I will share that my family, when I was growing up, did not go on vacations unless they were connected to a medical conference. My dad was a surgeon, and any trips we ever did was because there was a conference. And the one that really stands out to me was that we got to go to this tiny little island in the Bahamas called Cat Key. I was about 9 years old, so my little brothers were 5, and we had a little tiny house called Mayfair, and you could go right outside the back door onto the beach, and we collected these gigantic conch shells, which in retrospect maybe weren't allowed to leave the island, nonetheless. And even though this island was hardly populated, there was almost nobody there. Um, you had to be dressed up to go to dinner. So we were driving to dinner in our little golf cart. I was sitting on the back of the cart with my brothers, and I was wearing a long dress, very mid 70s. And it got caught on the wheel, and I fell off the cart, and my brothers said nothing. They said nothing. And my parents, who were facing forward, kept driving, and they arrived at the restaurant and saw that I was missing and asked my brothers what happened. And they said, "We think she fell off," like as if they would not know. So That is what I think of when I think of vacations with my family. And that's just one more thing.